We have our GMA cover story now. So many of you have weighed in with reaction and questions after our interview with actress Selma Blair about her MS diagnosis. Dr. Ashton is here to try to answer some of them in a moment. But first, we want to revisit what Selma told us. MS may have affected her voice, but not the power of her words.
I cried. I had tears. They weren't tears of panic. They were tears of knowing I now had to give in to a body that had loss of control. And there was some relief in that, because ever since my son was born, I was in an MS flare-up and didn't know. And I was giving it everything to seem normal. And I was self-medicating when he wasn't with me. And, you know, I was drinking, I was in pain, I wasn't always drinking, but there were times when I couldn't take it, and I was really struggling with how am I gonna get by in life, and not taken seriously by doctors. Just single mother, you're exhausted, financial burden, blah, blah, blah. And I even got to the point where I said, I need to go to work and I have to stay awake. I dropped my son off at school a mile away, and before I got home, I'd have to pull over and take a nap. And I was ashamed, and I was doing the best I could, and I was a great mother, but it was killing me. And so when I got the diagnosis, I cried with some relief, like, oh, good, I'll be able to do something.
What are doctors telling you? What's your prognosis?
The doctor I saw, he said within a year, I could have, at the time, he said, 90% of my abilities back. So this is to say, let's meet again next year and see if I'm better, if I'm not. And I can still have a conversation. That's good enough. I was a little scared of talking. And even my neurologist said, no, this will bring a lot of awareness because no one has the energy to talk when they're in a flare-up. But I do, because I love a camera. You
got a date. I'll see you in a year.
Okay.
It's a deal.
Oh my goodness, again, so much reaction. Her courage and her openness. Dr. Jen Ashton is here. And there were a lot of questions as well, because one thing that really struck a lot of viewers is when Selma, like so many others have said, it took so long for her to be diagnosed. Is that common?
It's common because you have to understand the intrinsic nature of MS. We're talking about a chronic, inflammatory, and often debilitating neurologic disorder. We don't know what causes it. Right now, there is no cure. There's just management. And when you hear a celebrity coming forward, it's doing exactly what she said, increasing awareness and educating people. But when you talk about making a diagnosis, this is not like strep throat. There's not one single definitive test to make this diagnosis. So what's required is 2 different episodes separated in time and location in our anatomy in the central nervous system where there's been damage or flares. And we have to remember that the symptoms, a lot of the symptoms that present with MS often present with other conditions as well. So it's partially a diagnosis of exclusion.
And women more so than men.
Right.
And we heard from one of our viewers, Christina, who wrote to our Facebook page. She said, so many people do not understand this disease because everyone who has it suffers differently. And that's something that we've seen over and over. It's not the same in everybody.
We have, Robin, and I want to explain to you why. Imagine, this is actually, think of this as our nerve, okay? Our nerves are wrapped in a protective coating called myelin, which is like this rubber insulation. In MS, you see that covering, that protective coating get damaged, get inflamed, and it strips away along the nerves and affects the way they signal and communicate. And that signaling goes on all over our bodies. So that's why the symptoms can be so vague, so broad, so common. The common ones, yes, they're more common. Things like problems with your vision, problems with your gait or the way we move. We've heard with Selma difficulty with speech because that requires nerve transmission.
But it may not always stay that way with her.
That's correct. Pain, numbness, tingling, these can be common with MS, but they can also be common with other things.
She is so hopeful. She is incredible, and many who struggle with this,
Right.
and you just don't know. You have to maintain that positive attitude.
That's the most important thing, Robin, is any chronic condition. There are ups, there are downs,
Right.
there can be flares, there are periods of remission. Everyone will have their own individual course, and the team taking care of that person, it's multidisciplinary. Yes, there are neurologists, but there are psychologists, there are physical therapists, there are complementary therapists, there are speech therapists, because we have to do what's right for you over a long period of time, and the body often follows the mind and the spirit. So your frame of mind and your attitude is so important. And as you know, as a survivor and a thriver, a lot of times we get that from outside support.
We certainly do. All right, Jen, thank you so
bet.
very much. And Dr. Jen Ashton will answer more of your questions about MS on Facebook Live. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.